And for the last 5 to 6 years, I consider it myself to be very fortunate to have been able to work alongside Representative Alan Peake and other members of our caucus for something I'm very, very passionate about, and that was making sure that our citizens in the state of Georgia had access to a safe, lab-tested medical cannabis oil for a number of diseases or diagnosis here in our state. And it's been something that has been both challenging and extremely rewarding because I've got to work very closely with these families. I've got to see this affect my own family. And I've also really had to ask the question of myself, when is doing what's right and putting everything else aside? Are we willing to really risk everything, politically, possible reputation in our communities, to do something that we know is the right thing and something that is going to help people, which is what I believe our charge truly is as elected officials. What made the bill necessary was we started hearing from a number of people. You got to realize we tried to pass cultivation in 2015. That was removed from the bill. We realized that Haley's Hope, the Haley's Hope Act, HB1, did provide the ability for patients, families in our state to access, to possess, rather, the medical cannabis oil, low THC medical cannabis oil. However, the problem was there was no access point. So we've told our citizens that you can possess this oil, but there's nowhere to buy it. There's no safe or legal access point. And if you go and retrieve it or pick it up somewhere, you're breaking federal law and both state law. And so the need for this bill, really a serious consideration, is when you have a mom who is literally trying to order off the internet blindly from companies because her child is having seizures, or her child has cancer, childhood cancer, or you're dealing with a son whose father or mother has Alzheimer's, Parkinson's, or the early stages of dementia, and they're learning how to cope and deal with a parent who's going through this situation, and then any number of diagnoses between those two. How are they going to do this? They see other families, they see these news reports, they're reading data on the internet, they're seeing Sanjay Gupta's documentaries about how this has helped these particular families. Here they are in a situation to where they know, or at least they're willing to try this on their loved one. Where do they go? Where do they turn? And so what we found out was that we had families traveling to either Colorado or New York or Texas or anywhere that they could get access to whole plant marijuana. Because you got to realize in these other states, they had state laws that prohibited non-residents from purchasing their oil. So these folks couldn't just drive into Colorado per se, walk into a dispensary, show a medical card, or ask to purchase pharmaceutical grade medical cannabis oil, and then drive back to Georgia. They were having to purchase what was hopefully safe flower, break the federal law, traffic it back to Georgia. Once they got here, try to figure out how to extract the oil so that they could administer it to their loved one. And we were just putting families, we were creating criminals. Our law forced people to become criminals. Law will cover all of the patients that are currently eligible in the state of Georgia. Those with intractable epilepsy, cancer, Parkinson's, Alzheimer's, HIV/AIDS, epidermolysis bullosa, sickle cell anemia, multiple sclerosis. Also, we were able to get intractable pain for those who have been treating with a physician for 6 months, who are no other clinically or FDA approved medication was working for them. They're under the supervision of their physician. and they were able to track that information, as well as our veterans. We were able to get some relief to them. They were suffering from PTSD. There was a large push and an advocacy from the veteran community to add PTSD to the registry. So those that are currently eligible, we weren't able to add any diagnosis, nor did we subtract any diagnosis, but they will be able to sign up to receive their card. And once they have their card, they'll be able to purchase in the state of Georgia once we can get that up and running, and I hope that that's very soon. We've seen about 3,500 new registered patients since the session ended this year. So we're up to about 13,000. I think now we're over 13,000. The doctor actually has to sign up as well onto the registry. I think at this point we have over 600 doctors that have signed up through the state registry. The doctor will recommend that this patient sign up and to receive the oil. The doctor at that point also has to submit 2 annual reports that they have met with this patient, they're treating this patient. And you also, the treating physician needs to know, because if there's any type of other medications that they would need to titrate differently, it's just good that that doctor be aware that the patient is treating with medical cannabis oil. It usually takes about 7 days. Once the patient is registered, the doctor has to then fill out information, the patient will fill out information, and then you'll get the sign off, and the state will mail you a card that says you're eligible to possess 20 ounces or less of low THC medical cannabis oil. Right now in the state of Georgia, there is no place to go. That's exactly why House Bill 324 was desperately needed. Hopefully, once the framework of this legislation is in place, there will be independent pharmacies that will be dispensing